So you exercise your whole life, you eat well, you can maintain proper weight, and yet you still have high blood pressure. What gives? Did you know there are two different types of high blood pressure? We're going to talk about that today. And if you watch till the end, there's special announcements I have for you. I've never done this before, but you got to wait till the end to watch it. See you there. Well, good morning. June 24th day of the Zipper Ninja 30-Day Walk Challenge. How are you all doing out there? Hope you guys are walking. If you haven't started yet, today's a good day to start. We have one more week to go, but I hope this becomes a new habit for you that you develop and you start just walking and continue to keep going so that you can continue to keep watching that blood pressure and make sure it goes down. So most people don't discover they have high blood pressure until they get this routine medical check because there's no symptoms if you have high blood pressure. And then once you go to the doctors and all of a sudden it's like, oh my goodness, I have high blood pressure now? When did that start? Well, there are two main reasons why you could have high blood pressure, and the two main reasons describe two different types of blood pressure. The first type of blood pressure is called primary hypertension or essential hypertension, or primary high blood pressure or essential high blood pressure. This is the type of high blood pressure that's a mystery to everybody. You've done all the different tests, everything comes out negative, everything comes out normal, yet you still have high blood pressure, and nobody knows why. And since nobody knows why, the doctor just chalk it up as possibly genetics, possibly because of eating habits, possibly because of lack of exercise, obesity. That's and there's just no reason for it. That's the primary essential hypertension. The thing is that you may have had this for quite a few years and you just didn't know that it was there because there was no symptoms. So there was no reason for you to get it checked. And point number two leads us to the second type of high blood pressure or hypertension, and that's called secondary hypertension or secondary high blood pressure. Now, the secondary hypertension has a reason to it. You just have to figure out what is wrong with it. So if you've been diagnosed with high blood pressure, here are some signs that may mean you have secondary hypertension. You've been taking high blood pressure medication for a few months and it's not working. Or maybe it used to work, but it doesn't work anymore. Or you've been watching and maintaining your blood pressure and suddenly you experience very high blood pressure, like 180 over 120 for no reason, and you have no family history of high blood pressure. Or you have sleep apnea. If you have any of these, you will need to ask your doctor to check for secondary hypertension. Look into your kidney functions, blood vessels, hormones, etc. The good news is that once this underlying medical condition is resolved, your blood pressure should go back to normal, unless of course you still have primary hypertension but was exacerbated by the secondary hypertension. So point number three, it is your health. Seriously, come on, it is your health. Don't put it at the hands of the doctors. Keep track of written records of your health and symptoms. When you go to your doctors, bring a copy of the notes with you and give it to your doctor. Your doctor can take notes, but your doctor also sees 20 to 60 patients a day. You just have to be in charge of one patient, and that's yourself. Your information could help your doctor determine whether it's a primary or secondary hypertension based on your symptoms. So if you don't say anything, your doctor has nothing to check for. They can't just run a gamut of tests on you just in case. It's not medically ethical or necessary. So you have to be the one responsible for your own health. And in conclusion, whether you have primary or secondary hypertension, it's important to know which one you have so you know what can be done for you. For some things, you really can't control yourself, but for others, you're going to need medical intervention. Now here's a special announcement that I mentioned in the beginning. I've never done this before, but I'm thinking about doing a free Zoom call for those of you who have high blood pressure and are interested in starting some kind of exercise routine. I'm also thinking about possibly doing a separate Zoom call, free, to share some of my acupuncture points with you to help relieve some stress and see if calming your stress and anxiety can help with your blood pressure, like it has helped my patients. If any of this is of interest to you, comment "I want to learn" below, and I will message you the details. As a doctor of acupuncture and oriental medicine for the past 25 years, and as someone who has passion in exercise and has personally trained others and helped them reduce injuries, I'm pretty sure I can help you in some way. So if you're interested, comment "I want to learn" below, and I will message you the details about this free Zoom call. And that concludes day 24 of the Zipper Ninjas 30-Day Walk Challenge. See you tomorrow.